If you're living with diabetes, you know that foot health is incredibly important. One of the most common complications from diabetes is foot ulcers, which can lead to serious infections and even amputation if left untreated. But the good news is, with the right care, diabetic foot ulcers are preventable. Hi, my name's Alyssa, and I specialize in wound care. And in today's video, I'm going to walk you through the essential tips for preventing diabetic foot ulcers and keeping your feet healthy. So let's get started. Before we dive into prevention, let's quickly talk about what diabetic foot ulcers are. So they're open sores or wounds that typically form on the bottom of the feet caused by a combination of nerve damage or circulation issues due to diabetes. Because of these factors, small cuts or blisters can quickly turn into serious ulcers that are difficult to heal. Without proper care, foot ulcers can lead to infections and even require amputation, which is why preventing them is so important. Now let's go over the 7 tips for preventing diabetic foot ulcers. So tip number 1, inspect your feet daily. So regular foot checks are one of the most effective ways to catch potential issues before they become serious. Look for any cuts, blisters, redness, or swelling, especially between your toes and on the soles of your feet. If you have neuropathy or nerve damage, you might not feel pain, so it's even more important to visually inspect your feet daily. You can use a mirror to check the bottom of your feet if you have a hard time seeing. If you spot anything unusual, don't ignore it and contact your healthcare provider for advice. Tip number 2, keep your feet clean and dry. So wash your feet daily with warm water and a mild fragrance-free soap, but make sure you dry your feet thoroughly, especially between the toes, because moisture can lead to fungal infections or skin breakdown. After drying, you can apply a light, non-irritating moisturizer to keep your skin soft, but just remember, don't put lotion in between your toes as the moisture in the area can increase the risk of fungal infections. Tip number 3, wear proper footwear. So ill-fitted shoes are one of the main causes for foot ulcers. Tight shoes can create pressure points that lead to blisters, while shoes that are too loose can cause rubbing or irritation. So make sure your shoes fit properly with enough room for your toes to move comfortably. Diabetic-friendly shoes, which are designed with extra depth, cushioned insoles, are a great option. They help reduce pressure on your feet and protect them from foot injury. You should always wear socks and opt for moisture-wicking socks to help keep your feet dry and prevent friction. Tip number 4. So keep your blood sugar levels in check. So high blood sugar can damage nerves and blood vessels in your feet, which increase the risk of foot ulcers. By keeping your blood sugars levels within the recommended range, you'll support your body's ability to heal and prevent complications. So follow your doctor's advice on managing your diabetes, whether that means taking your insulin, eating a healthy diet, exercising regularly, or taking medications. Regular blood sugar monitoring is key to staying on top of your health. So tip number 5. You're going to protect your feet from injury. So avoid walking barefoot, especially outside or on hard surfaces, as this increases the risk of cuts, bruises, or other injuries. You're always going to wear socks and shoes, even if you're indoors, to protect your feet from accidental bumps or scratches. If you're going outside, wear shoes with proper soles and avoid walking on uneven surfaces that could cause falls or injuries. Next is tip number 6. So managing corns, calluses, and toenail care. So corns and calluses can form on surfaces of feet where there's constant pressure, and they can create openings for ulcers. So we do want to regularly use a pumice stone or callus remover to gently remove, but never cut the corns or calluses yourself. We're just gently removing them and making sure that you are watching what you are doing, because I have had instances where people actually use a pumice stone and they go too deep and it causes bleeding and even more issues. So once again, never cut them. And if you do want them removed, have it done by a healthcare professional if they are quite thick. When trimming your toenails, you want to make sure that you're cutting them straight across to avoid ingrown toenails, which can lead to infection. So if you have any issues with your feet or are unsure about, don't hesitate to reach out to your medical professional. Lastly is tip number 7. So you want to stay active and maintain a healthy weight. Regular physical activity improves circulation, which is essential for foot health. It also helps control your blood sugar and reduce pressure on your feet. Simple activities like walking, swimming, or cycling can be very beneficial. Also, maintaining a healthy weight takes pressure off of the feet, helping prevent injury. Remember, a healthy diet filled with vegetables, fruits, and lean proteins support both your feet and overall well-being. To prevent diabetic foot ulcers, it's all about daily care and attention. Inspect your feet regularly, keeping them clean and dry, wear proper footwear, manage your blood sugars, protect your feet from injury, and maintain a healthy lifestyle. By following these tips, you can greatly reduce your risk and keep your feet healthy for years to come. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.